Hi Marilyn, thank you for joining us today. For those of you who don't know Marilyn, Marilyn is actually the UK's leading women's health nutritionist. So thank you Marilyn for taking the time out.
You're welcome, Terry.
And we're talking about the menopause, aren't we?
We
And
are.
right, HRT. I mean, that is such a contentious issue. I mean, people talk pro. There are people who seem to be very much pro HRT and people who are against HRT. But from your perspective, what is HRT and what are the benefits and risks for women, considering it today?
Well, we're talking about hormone replacement therapy, and for me, I view the menopause as a natural stage in our lives, that we're going to go through the menopause and come out the other side, and we can live 30 to 50 years past the menopause now as a woman. And so hormone replacement therapy is suggesting we replace the hormones that are naturally declining at this stage in our life. And that's where the risks are, because we're putting hormones back at that point, and we're almost saying, well, nature's got this wrong. It is very different if a woman goes through an early menopause, which is before, or premature menopause before the age of 40, and she needs those hormones replacing to protect her bone health.
Yeah.
But through a natural menopause, the risks are there because we're putting these hormones in when actually they're reducing in our bodies naturally. And the biggest risk is the risk of breast cancer. There are other risks like the risk of strokes, heart disease, and it is a woman weighing up those risks. She may have a family history of breast cancer and actually know she shouldn't be taking it, or had had a thrombosis in a pregnancy. So there are individual risks as well that make it worse, but there are risks of breast cancer even with no family history risk, and it's weighing up all the time benefits versus a risk with a medication. And some medications, definitely the benefits are there. But I think around this time in our life, which is a natural stage and not a medical problem, that we're adding in a medication that can give us the risk of something like breast cancer, when actually this is only a transition of us moving from this one stage through the menopause and out the other side.
If there are women who feel there is no option other than take HRT and it's been prescribed for them, is there an optimum period of time? Because there are women who certainly have written into us who said that they've been on HRT for up to sort of 10 years and they really don't know what to do about coming off that. Would it then trigger the menopause later? They're just delaying the problem, or would they never be able to come off it?
They're not delaying the menopause because the clock on the menopause ticks away underneath. So they're not delaying the menopause, and they won't come off at 60 and get their periods back.
Okay.
But their body can get used to a much higher level of those hormones. And the difficulty, if women are just told, well, stop it, they can actually feel certain symptoms come back. Some women won't. I have written a book called Natural Solutions to the Menopause, which talks about weaning themselves off of HRT. And I think that's the best way to do it, is gradually reduce those hormones. A bit like when we go through the menopause, the hormones should be gradually reducing. The Committee on Safety of Medicines is now saying, though, maximum of 5 years, and then women should come off it, because the risks of the breast cancer are going to be much higher after that, because we're also older as well. So really, if a woman's going to take it, it should be for the shortest possible length of time and the lowest dose possible. And my advice would be to try the natural remedies first and use the HRT as the last resort if they need to use it.
Right, excellent, thank you. I mean, what we will do as well, we will give people the link to your book, so if they want to, and I've read that book, it's an excellent book. And
Thank you.
from my perspective, I learned a lot. So hopefully we can give people a link, and if they're not sure about anything that comes out of our discussions, that they know where to go for the information.
And I think one other one we ought to mention are the bioidentical hormones,
Right.
because some women feel that the bioidentical hormones would be a natural way to go instead of going for the usual prescription HRT. But to be really clear, that the natural side of it only means that they're chemically identical to the hormones that we would produce in our body naturally, but they are still a drug. They're still made in the same way in the lab as HRT would be, but also it's still hormone replacement therapy, and they still carry the risk of breast cancer. So women need to be really clear that whether they're doing it in a bioidentical form or the form on prescription in the UK, they are still replacing hormones that basically shouldn't be there at that stage in a woman's life, and still they have to come off them, or else the question is, are they going to stay on them for the rest of their life? That's the question. When do you come off these hormones?
Absolutely, especially if we're looking at possibly living 30 to 50 years beyond.
Yes, and it's a long time. And if women are taking them with the perception that they're using them, especially the bioidentical ones for sex drive or prevention of osteoporosis, when our risk of hip fractures isn't around the age of 75 or 80, you'd have to stay on them for life.
Thank you.